Hi there, welcome to this week's Ask Amy. Today I want to talk a little bit about handoffs. There are three components that I want to make sure you are including in your handoffs that are going to make the patient feel understood, set your next person up for success, and give you the best opportunity to communicate well. First thing is make sure that you're not sending anybody anywhere in the office unless it's out the door without a handoff. It seems like, based on some videos I'm seeing and conversations I'm having, that patients are being sent to different parts of the office without a handoff. And so let's make sure that we're not doing that. You're escorting a patient through an experience, and you wouldn't send a guest in your home here's the house, take care of yourself, I'll see you at the end of the day. We wouldn't do that. We would take them and show them where they would be sleeping. We would show them where the snacks and drinks are. We'd show them the restroom, and you don't have to go on a full-out tour, but you would never send somebody, a guest in your home, around without making sure that they're taken care of, introducing them to other family members. It's the same thing. So make sure you're not sending patients anywhere in your office in any part of the process by themselves. And so first thing, three components I want you to make sure that you keep in mind. This is for anyone handing off to anyone. It doesn't matter what your role is in the office. Always include something personal. Okay, it could be something you've been talking about, most likely is, or maybe you remember so-and-so from last week. Remember they had just moved here, and wow, they, since last week, they're really enjoying things and settling in. Whatever it is, always include something personal. Now, the second component is make sure that this is patient-centered, that there's nothing in the handoff that says, I would like to see Mrs. Jones back, or I would like Mrs. Jones to do this, or Mrs. Jones needs to do this. It's Mrs. Jones has decided she would like to. That's the kind of language that you want to use throughout that handoff. And so again, it's very patient-centered, okay? Now, the third thing to remember is to, whatever this means in your role, set the next person up for success. All right, and so let me give you some examples. If you are the front desk person heading off to the hygienist, a few ways you can set the patient or set the hygienist up for success is making sure that you have had some conversation about the things that they want, about the patient's motivation, about what they're wanting, and what they're thinking. You've also gone through the process of discussing the planning appointment. You've planted that seed. And so all of those things will help set the hygienist up for success. Hygienists, you can set your front desk up for success by letting them know we've already scheduled the planning appointment. Mrs. Jones has decided to go ahead and take care of that. Hygienists also setting your doctors up for success. Same thing. We've scheduled the planning appointment. That's what Mrs. Jones would like to do. She has a lot of things on her mind, or things are great right now, but she wants to prevent things. She would like to maintain what she's experiencing now with her teeth. So given that, she has decided to sit down with you, doctor, and come up with a plan so that she can make sure and minimize the amount of dentistry she's going to have to experience over the next 10 years. Again, things like that are very patient-centered. This is what the patient wants, but yet whoever you're handing off to, you are setting them up for success, you are saving them time, and things are handled. Doctors, when you're handing off to the front desk, okay, you have already gone ahead and closed. You've quoted the fee. And, it might go something like this. Susie, Mrs. Jones has decided to move forward with her treatment. And Mrs. Jones, in an effort to save her time and make sure that she gets my uninterrupted, undivided attention, let's go ahead and schedule her at 8 o'clock next week for about 3 hours. Mrs. Jones and I talked about the fee, or the investment, for what it is she's wanting to accomplish. It's $92,000, and she would be interested in seeing how she can save some money, first of all, and she's the only one that can save you money, Mrs. Jones, and obviously wants to maximize her insurance. I told her you were an expert at that, and that would not be a worry, and so I told her you would take great care of her. And, again, those things that you can do, that you can say, that are going to set the next person up for success are crucial. So again, First of all, make sure that you have a handoff including personal information. It's very patient-centered. There's no I, me in that conversation, and that you are setting the next person up for success. Handoffs are great things to role play. They're great things to practice. If you're going to implement that, it's very difficult to do just in the heat of the moment with a patient when you've got your mind going in 20 different directions. So you have to practice it. Write it out, script it out in your own words. Don't use my words, don't use someone else's words. Take those concepts, those 3 components, and script out a handoff in your own words. If there's anything I can do to support you through this, I hope you will give me a shout, and I can promise you, handoffs are really the glue that hold things together. I will talk to you next time. If there's anything that you'd like covered in these Ask Amy videos, I hope you'll shoot me a note at amy@bradygroupllc.com, and I will always do my best to include those topics. See you next time.